Afternoon, everyone. Thank you for joining us at relatively short notice. My name is Brittany Cadence. I'm the Communications Manager for Peterborough Public Health, and we appreciate you joining us for this special update on the local COVID situation. Very pleased to have our Medical Officer of Health, Dr. Thomas Piggett, here to share a few words with us. And we will provide an opportunity for Dr. Piggett to give us an update, and then an opportunity for media reporters on the line to ask a few questions. It'll be a few less slides than usual, but we'll get right into the heart of the matter. Before we begin, though, we would like to take a moment to pause and reflect about this beautiful place we call home. And I'd like to begin with a land acknowledgement. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. So now, to provide us with an important update on the local COVID situation, I'm pleased to hand it over to Dr. Piggett, our Medical Officer of Health. Please go ahead, Dr. Piggett.
Thank you so much, Brittany, and thank you everyone for joining today. So I'm going to begin by saying, we've always said that COVID-19 and this pandemic is ever changing, and the past couple of weeks have once again reminded us of that. So the first piece of news that I do have to share with you today is that Peterborough Public Health's confirming today we've just recently learned of 2 local cases of the Omicron variant of COVID-19 in the Peterborough Public Health region. This was something that we knew was coming, so this is not surprising. Omicron has become the dominant strain in Ontario, and we know that it is so transmissible that up to 8 times as many people may be infected as compared to the previous strains circulating. There is lots of conversation and attention to whether Omicron is less severe than previous strains. And unfortunately, it is too early to know for sure because severe illness, hospitalizations, and deaths tend to lag behind and tend to affect more vulnerable populations after affecting more healthy populations. And so this is something that we are keeping a very close eye on, but we remained extremely concerned by. As a simplification, even if Omicron ends up being half as severe as other strains, if it is 8 times as infectious, it could still have 4 times the burden of any previous wave on our public health and healthcare systems. And so I'm going to share with you what Peterborough Public Health is doing. We're going to talk through some of the public health measures and what businesses and people in the public need to be doing as well. First of all, vaccination remains our most important tool. With Omicron, we see that if you only have 2 doses of the vaccine, protection drops dramatically. However, very encouragingly, a 3rd dose booster is very effective against Omicron and can help to increase protections. So therefore, we are pivoting and we are focusing all of the effort that we can mobilize in our community and in our organization to scale up our vaccine clinic capacity and to vaccinate as many people with 3rd dose boosters as we can. I have told our team and given our community an ambitious target of a 5-fold increase in the number of vaccinations that we attempt to do over the coming weeks as compared to what we were originally planning. And we will, in this period of time, add many appointments as soon as we are able to. I can confirm today we are launching 5,500 additional appointments. And so if you have been trying to get an appointment for your 3rd dose booster and have not been able to date, please keep checking back because we will be adding as frequently as we are able to create those appointment availabilities. Please also check through the local pharmacies that are participating for additional availability. So we are redeploying all of the staff that we can from Peterborough Public Health to aid in this effort, but we are also turning to the community and we're seeking help from volunteers as well as people who can serve as vaccinators, healthcare providers, and administrators to help with our vaccination clinics. And this is a all hands on deck effort. And so if you are interested in helping and supporting, please visit our careers page. We have links for expressing your interest, and we need all the help that we can get. At the same time, we know that multiple tools are always needed in our response to COVID-19. And so while we continue to focus on vaccination, we are also strengthening local public health measures. The time to get off the train tracks is when we see the train approaching, not after it has hit us. And the public health measures will be extremely important in helping us to protect our population against Omicron. We last night released 2 letters of intent whose purpose are to help businesses be able to operate more safely for their staff and patrons. And these provide also particular guidance to higher risk settings such as food and drink establishments. We want them to continue their business, but we want them to do it in as safe a manner as possible. The majority of health units in Ontario have now put local measures in place through these letters of instruction. And we have followed suit with those issued last night, which take effect on Wednesday. The first letter of instruction applies to all organizations, and it echoes the recommendations that came down last Friday from the Chief Medical Officer of Health, where if staff can work from home, they should be. Our organization, Peterborough Public Health, is modeling this as I am myself working from home today, and we need to do this where it is feasible so that we can minimize interaction and potential spread in the community. We also are providing guidance for food establishments, and they are as follows on this figure here. I will not read them all out, but these measures are intended to help them to continue to operate, but recognize the significant outbreaks, including in one jurisdiction, a restaurant case spreading to 42 patrons. We have measures in place to improve and emphasize the importance of wearing a mask, even while seated, but while not eating and drinking, and other measures too to ensure that mask use is appropriate, as well as interaction with others and the risks that that could provide minimized. I want businesses to also be thinking about the importance of ventilation in their premises. While this isn't explicitly in the letter of instruction, ventilation, including good, strong HVAC systems and filtration, or natural ventilation, including doors and windows, can help to really decrease the risk of spread. As we know, there's an important component of airborne transmission associated with COVID-19. I want to also emphasize that masks are very important, and tightly fitting masks are extremely important and should be used by individuals as much as possible. This includes a medical grade mask or respirator mask. Something that is very tight will decrease the risk of either becoming infected or infecting others. Finally, I want to share some tips for the public in navigating the coming days and weeks with the holidays. I know many of you are thinking a lot about the holidays and what it means for the plans that we have. My first and foremost advice is to check and make sure that you are complying with all local and provincial guidance around the holidays, and understand that this is changing at times. And so make sure that your activities are in compliance with it. The most important protection we have is vaccination, and you should not be gathering with individuals who have not themselves been vaccinated. That can pose a risk and we know that that risk is even more significant in Omicron. Thirdly, it is very important to stay home and not attend these gatherings if you have symptoms. With recent cases, we are noting a complacency among people who are out and about with some symptoms that they think are mild. But know this, even if you are vaccinated with 2 doses of the vaccine, you could still be infected with COVID-19 and you could still spread it and infect others. Additionally, think about testing and the use of rapid testing if it is feasible. These tests are available commercially. They're being distributed by the Ministry of Education to school children, and the province is increasingly looking at other ways to distribute rapid antigen tests, including holiday blitzes, which will be at various locations in the Peterborough Public Health region, where individuals will be able to get free tests that they could utilize. And this is useful, especially if it's before a gathering and you know that you are negative prior to going to a gathering. I think that and trust people from the public will use this information wisely to make safer decisions. The fourth tip is to spend time outdoors wherever possible, especially if it's with other people. Outdoor activities are always going to be safer than indoor activities, so certainly look to bundle up, or if the weather's great, get out. But if you are deciding to spend time indoors with people from outside your household, ventilation is extremely important. Opening a window or a door in the living room or in your kitchen every hour for 10 minutes to circulate air can dramatically decrease the risk of infection. And wear a mask. Continuing to wear a mask, even indoors, even with others, is an important activity because it will protect you. And the mask, again, should be tightly fitting. The final update that I have is that today's tracker will be reporting another COVID-19 death, and this is sadly our 3rd local death since December 6th. This death was in an individual, a male in his 40s, who was unvaccinated. Our deepest condolences to his family and all our families who have lost loved ones through this pandemic. So Brittany, I'll now turn it back to you, and I'm happy to answer any questions from the media. Thank you.
Okay, thank you very, very much, Dr. Piggott. Okay, I'd like to start with our colleagues from Global News. Jessica Nisnik, I believe you're here with us. If you've got some questions for Dr. Piggott, please go ahead.
I do. Thank you, Brittany. Hello, Dr. Piggott. Thanks for meeting with us today. Pretty good, except for the last thing you mentioned, the death. Very sad news. Did you say when it happened?
It will be reported in our tracker today, so it's just happened in the last couple of days, I believe.
Okay, that's it for me, actually. You were very well spoken, and I have what I need to get going for my story. Thank you so much, Dr. Piggott. Thank you, Brittany.
Thank you, Jessica. Okay, Greg Davis, are you still here with us from Global? Did you have any questions for Dr. Piggott?
Yes, I do. Just one quick question. It's actually been mentioned by some members of the public since you came out with your instructions last night. What about schools is the main question from the public. Are you considering any measures for the school population?
We are following the provincial guidance around schools, and we have seen some outbreaks and some cases, but we've been able to keep them in good control to date. I know schools are finishing this week, and I know in general, the incredible importance of in-person learning for schools. So we are recommending schools and school boards look at our guidance around individuals who are able to work from home, etc. But we're not issuing directions at this point to schools. We'll obviously keep abreast of evidence and keep a close eye on issues related to schools at this point, but we do also recognize the incredible importance of in-person learning for school children.
Okay, and one quick follow-up with that. With respects to children, what about sports teams? Because I know I can speak personally. I have a son involved with hockey tournaments in and out of town. Any consideration there?
We are not issuing formal mandates. However, what I would say is across the province, we are seeing significant outbreaks in those kinds of activities, especially where individuals are mixing with other individuals from other regions. And we know that these are very high risk. I would be very cautious around the planning. And I would personally be really considering how essential different, sporting activities are and how much risk that they pose. So again, we are not issuing direction that these need to be canceled. However, I think it is a very good idea to reconsider larger sporting activities and tournaments because of the risks that they do pose.
Okay, thank you. Thanks for your time.
Thank you, Greg. Okay, let's hear from Paul Rellinger, who's joining us from Kawartha now. Paul, go ahead if you've got some questions for Dr. Piggett.
I do, Brittany, and thanks so much for that. And thank you, Dr. Piggett, for bringing us together today for this important update. Just a couple of things. The 2 cases of Omicron that you alluded to, are they, do we know if they're travel related or community transmission?
So I can't provide a lot of details, as you know, about the specifics of these cases. I will say these 2 cases of Omicron are not linked to one another. One of them is linked to a known Omicron case, but the source of the investigation has not been determined. It is still in progress. So my advice to the public is to behave as though Omicron is here and is spreading in the community. And I do anticipate that we will see many more cases in the coming days.
Thank you for that. You just to follow up on the appointments for clinics. If I heard you right, the emphasis now is on booster shots. And I called Monday myself for a 3rd shot and was told there's nothing available and just come back later. So if what you're saying is correct, I take it that's going to be rectified soon, you hope?
We are trying to escalate the number of appointments as quickly as we can, and apologies for your personal experience there. And I just encourage folks to be patient and persistent with us. Again, 5,500 new appointments coming online today, which will really help us. We know the demand will be much higher now that since Monday we've rolled out to the 50+ group for boosters, which is a large segment of the population. So we will continue to add as we're able to staff and find locations, but we are dramatically scaling up, again, 5-fold increase in the amount of appointments that we are offering compared to what we had originally planned. And again, those are based on appointments at this stage. Certainly, if we find that the demand is changing and we have the capacity to, we will obviously look at opportunities to make it as accessible as possible, including walk-ins. That's not the case, though, at this point. At this point, we're still encouraging people to be persistent and to try to book appointments. And if you weren't successful, to try again in the near future.
And thank you. And no need to apologize. I was very patient on the phone yesterday, so it was all good. Right now, I think all of the vaccinations are, from a PPH perspective, are being done at the Healthy Planet Arena. So what you're saying is there may be a possibility of more physical locations for clinics coming up?
We are looking at several additional sites, including in the city, as well as a rotating team in the county that would be in a different community every day. So again, we're both extending the hours of our current mass immunization clinic site, but we are also taking on additional locations. And this will all be contingent on getting more help. Again, we're redeploying all the support that we can from within Peterborough Public Health, but we're also turning to the hospital, to our primary care partners, and to the general public, looking widely for help anywhere that we can find it. And again, you can go to our careers section of the website. There are surveys there, whether you're interested in being a vaccinator, an administrator, or a volunteer. And we appreciate all the help from the public we can get.
Just one more question and a clarification. You mentioned the most recent death, very sad. Right now, the dashboard is showing 26 deaths, so this would bring it to 27, correct?
Correct.
Okay. And one more thing. You talked much about the holidays, which are coming up very quickly. That not only includes the Christmas holiday, but of course, New Year's Eve. On New Year's Eve, a lot of pubs will be open, bars. Do you anticipate the need for different rules? Because that is much different than a restaurant setting. And having said that, if I could also ask, it's kind of a basic question, I guess, but what are your fears for January coming out of this holiday? I mean, Omicron is here now. All we can do is really hope to control it. But coming out of the holiday, you must be losing a little bit of sleep over what's possibly ahead in January.
It's my job to lose sleep, and I think that the current situation is deeply concerning. But it's also my job and our job in public health to try to get out in front of this and to decrease it as much as possible before it is here, before it has arrived. That's why our additional measures yesterday that we put into place, which we hope will have a minimal negative impact on businesses, but really help them continue to operate and do so safer. I think that these will be really useful, and they do apply to food and drink establishments and premises, including the need to be seated while consuming food or drink. So I think that this will certainly help to protect, and this is all based on risks that we're seeing and massive outbreaks in other jurisdictions, so that we can try to prevent them from happening here.
Wonderful, Dr. Piggott. Thank you so much for your time. And that's it for me, Brittany.
Okay, great. Thank you very much, Paul. Okay, I'd like to invite Reg Watson, who's joining us from the Peterborough Examiner. I'm sure you've got some questions, Reg. Please go ahead for Dr. Piggott.
Actually, I will pass it along to Bill Hodgins, my colleague.
Okay, Bill, if you've got some questions, would love to hear from you. Go ahead.
Thanks, Reg. Yeah, I got a couple of booster related questions, if that's all right. Sorry. The first is Christmas is what, 11 days away. If I get a booster tomorrow, which I am, how long does it take to really reach full effect?
That's a great question. Thanks for that, Bill. The short answer is we think 5 to 7 days. With your first and second doses, we usually think of the protection as only coming after about 2 weeks time period after your second dose. But we really do believe, 5 to 7 days after the booster, you're getting a significant benefit. It's not perfect protection against Omicron. It is appearing like it may be somewhere in the order of 75%, as opposed to, we remember it was closer to 95% with 2 doses against previous strains. But that is still a tremendous protection.
Okay, and a second question, just because I've heard other people ask this. Sorry, a lot of people got AstraZeneca for their first shot. Then they got either Moderna or Pfizer for the second. What's your advice for the third? Should they stick with what they got for the second, or is it better to be covered by all three?
We don't have evidence indicating whether there's a slight benefit with one vaccine or the other. I think it is perfectly reasonable to continue with the same vaccine that you've had for previous doses.
Okay, that's good for me. Thank you very much.
Great. Okay, thank you very much, Bill. Okay, I see joining us also from Havelock, the Havelock Rail, we have Daniella Frazier. Did you have questions for Dr. Piggott today, Daniella?
Just one. Has there been any added measures for the agencies that provide home care?
There are no added measures specifically targeting those agencies in these 2 letters of instruction that we're talking about here today. There has been lots of guidance and support and messaging from an infection prevention and control standpoint. They, as healthcare workers, are a priority group, and it's very important for healthcare workers to get their 3rd dose booster. but we are not providing specific instructions in today's update. We are, however, trying to support a wide variety of organizations that serve seniors, individuals in congregate living settings, retirement homes, long-term care, etc. That has been a big priority of ours this week in the face of Omicron, to help to support and provide some guidance so that they can be ready and prevent outbreaks from happening in those settings. So I would encourage them to see our website and our guidance, and to reach out if they have questions or would require support.
Just one more. And should a worker go into a home and then a few days later ends up testing for testing positive for COVID, who is responsible for contacting those clients? Public health or the agency?
Public health is involved in contact tracing in the community. So that's an activity that we help to support, so that individuals could know that they were exposed, what to look out for, what to do, and to seek testing.
Okay, thank you.
Great, thank you very much, Daniella. Okay, let's hear from Matt Latour from Oldies and Freak Radio. Go ahead, Matt.
Always keeping you on your toes, Brittany. It's Jordan sitting in for Matt.
Oh, good stuff. Nice to have you here with us, Jordan. Go ahead.
Thank you very much, Dr. Piggett. I really appreciate your time. I've got a couple of here for you, and like Greg, I'll ask one out of self-interest, and that's, what's your recommendation when it comes to travel? There's a lot of people who are going to be watching this who possibly have already paid for travel plans and all that. There's rumors that there's going to be a discussion between the Prime Minister and the Premiers tonight talking about rules, but just personally, what would your advice be for people who might be considering traveling over the holidays?
That's a tough one. I can tell you that I'm planning to stay home and have a low-key holidays personally, and that's about as best as I can message to you for now. And I think for you and for your listeners, it's just very important to consider your own specific risk context. I have 2 daughters who are too young to get vaccinated yet. They're under 5 years old, and so I'm taking added measures and precautions. Some people may have individuals that they are close to, who are vulnerable, who are elderly, who have medical conditions that could put them at higher risk. All of those reasons are reasons to reconsider and be extremely careful with plans. But ultimately, outside of the guidance that is provided on what you can and can't do, it's up to individuals to make their own judgments based on the risk to protect themselves and their family.
It hasn't happened yet, but is there consideration for providing a little bit more guidance in terms of, in-person gatherings for the holidays? I know you put out some great tips for people with ventilation and stuff, but in terms of sheer numbers, are you going to possibly stay in line with what the province is staying at as well?
Thank you for that question. It's a piece that we're constantly assessing in the context of the current risk of Omicron, and trying to make decisions that are in the best interest of the community and protecting the community. So it's something that we will keep a close eye on in the coming days.
One last one here for you, and that is messaging. Obviously, the fine folks over at Peterborough Public Health do a tremendous job, and they have this type of access. What do you say? Because more and more as we go on, and it's been almost 2 years, and so you meet people who aren't connected to the news all the time. And, just how do you keep them engaged with the message of the day, I guess, is the question. Because more and more people that I'm interacting with, it's sort of like, what's going on? Okay, yeah, I'm just going to move on. And they're just, obviously we're all tired of talking about it, but how do you keep those people kind of engaged?
Yeah, it's a tough question, and something that we're constantly trying to do here. And we're trying to put out useful messaging and tips. Especially around our safer holiday planning and considerations. We're trying to be cognizant of the fact that people are tired of this, people are complacent. But these measures continue to be extremely important in protecting us. I really just hope that it won't take something more dramatic and severe to wake people back up to this. I hope that they will see that what we are faced with now with the extremely concerning context of Omicron should be a wake-up call, and that we all have a role to play. Vaccination continues to be our best tool in the toolbox, but there's a whole suite of tools that we need to be using because it takes more than one in the response to this pandemic and this variant.
Dr. Piggett, thank you so much for your time today. And Brittany, thank you as well.
Thank you, Jordan. Okay, Graham Elliott, you're also joining us from our local radio stations. Did you have any follow-up questions, or are you good to go? Okay.
Jordan was my man.
Okay, he always does such a good job. Thank you all. Okay,
We lost you on mute there, Brittany.
Sorry about that. So let's hear from our friends at Trent Radio. I believe we have someone joining us from Trent. If you've got some questions there, go ahead.
Hi, Brittany. Yeah, it's Rob, but I think actually everything that I had has already been covered, so I will pass. Thank you very much.
Okay, great. Glad we could help out with your information needs there. All right, then I also see joining us, we have a guest from Peterborough, Canada. Did you have any questions for us today?
No questions, Brittany, but thank you, and thank you, Dr. Piggett.
All right, great. Well, that brings us to the end of our media guest list. So thank you again all for joining us. This will be recorded, or has been recorded, and will be posted on our YouTube channel, so you can always follow up for more information and for reference there later. We will continue with this Thursday's COVID media briefing as well at 12 noon. So do join us again then for the latest update. And thank you all for participating today. Thanks again, Dr. Piggett. Take care now. Stay safe.
Thank you.
Thanks.